And Gil, I just want to run through a couple of questions in the chat box because I think we
Yeah.
can get through them really quickly. They're all about prednisone, and we can sort of address them and move on from prednisone after this. So does the risk decrease when your prednisone dosage decrease? We think so. Again, the number that we're giving is 20 milligrams and above of prednisone daily is where you're at higher risk. The number is fairly arbitrary. So if you're on 17 and a half or 15, you may still be at higher risk, but that's sort of the number we give. And the lower dose you're on, the less risk of complications from COVID-19. We think, we don't know that for sure. The data is not there yet. And then the next question was, does the SPHERE outcome include individuals who were on prednisone in the past and not currently? So no, we think that after a few weeks of being off prednisone, your risk returns to normal and your body returns to normal. That's not always the case. That adrenal suppression can happen, weeks out from being on a long course of prednisone. So you have to speak to your doctor about whether you think that's an issue. But certainly if you were on it 6 months ago and haven't been on it since, that you're probably not at risk for fighting, any problems fighting COVID-19 compared to others. Would a short dose of high dose IV prednisone be more safe than long-term use of prednisone? Maybe Jennifer, I'll get you to answer that question. I'm not sure how to answer that. Oh, you're muted.
I'm muted. And maybe do you want to repeat the question just for the audience as well?
Sure. If you had a choice, should you use a short high dose IV steroid? So it wouldn't be prednisone, but it would be methylprednisolone or hydrocortisone. Is that more safe than using a long-term prednisone orally?
Yes. Well, I think a lot of the steroid-related side effects come with, cumulative exposure. So if I had to pick my poison, I would probably choose the high dose, hit 'em hard, short-term steroid approach. But obviously, the chronic exposure to steroids is a big concern. And as with any therapy, our goal is to wean patients off steroids as quickly as we can.
And I mean, it's important to note that high dose 5 days may settle inflammation a little bit, but it has not been shown to induce a real remission for Crohn's disease, right? So it's unusual that we, as gastroenterologists, would use like super high doses for 5 days and then stop. Asthma they do, but not so much in Crohn's disease. And then Remo, how would you define long-term use of prednisone? I said long-term. Is it months? Is it years? Like what's long-term to you?
Yeah, I mean, there's different sort of tapering regimens and everything, but if you're on steroids for more than 3 months in general, that we would consider that long term. So there's, if you're on more than sort of one course in a year, that's considered what we call steroid dependency. So those are both considered long-term. One of the things that I just want, I'm not sure if you said this, Eric, is we don't, even if you're on 20 milligrams or above prednisone and you're listening to this, the one thing you should absolutely not do is stop your prednisone abruptly, right? And I'm not sure if you had mentioned that.
I should have. We've said it multiple times in past webinars, but you're absolutely right to bring that up. Thank you, Rima.
Yeah, so it's for the same reason or the rationale that Eric had explained. Unfortunately, your adrenal glands are very, very lazy and they stop working and they don't wake up very quickly if you stop their prednisone. So if you have what we call exogenous steroids, you're taking steroids, your adrenal glands take a little while to wake up, and that's why we actually taper prednisone. So if you're on a dose of prednisone or you've been on any dose, and you abruptly stop it before 7 days of being on that drug, you're at, or after 7 days, you're at risk. So please don't stop your prednisone. Always taper off of it. And if you've been on it for a very, very long time, you'll even notice small changes. Your body may react to it. So it's a very important thing. If you're on prednisone, you're on for a reason. If you want to get off, always speak to your doctor.
Absolutely.
And Jenna, I'm wondering if you could talk a little bit about budesonide. I know Eric covered it earlier, but one of the questions from the audience was, if you've been on budesonide for a very long time, does that impact your risk of steroid side effects? And so just because we've been so focused on corticosteroids, prednisone, just wondering if you could give us a little bit of insight onto budesonide, and that's anticorticotropin.
Yeah. I mean, budesonide, as I'm sure many of you know, is a pretty safe steroid option that the liver eliminates or breaks down 90% of it after it's absorbed from the bowel. So it tends to work most effectively in the last portion of the small bowel in the right colon. So For individuals with mild to moderate disease, it's a very attractive option, and it would certainly limit your systemic exposure to the steroid. But it is still a steroid, and although studies have shown that it's significantly safer than a systemic steroid like prednisone, there is, over the long term, cumulative exposure, even to a medication like budesonide, there's potential for steroid-related side effects, but much less so than with a medication like prednisone. But at the end of the day, if you have severe disease, you really should choose the approach that's going to most effectively and rapidly induce remission to keep you out of hospital, and then discuss longer-term treatment options with your gastroenterologist.
And there's another question about, does prednisone's effect, is it current or even past exposure? Let's say you were on prednisone 6 months ago, could that potentially affect it? And we believe that once you've stopped prednisone and you're weaned off of it, the effects of corticosteroids should come out of your system. Sometimes the side effects and the complications you sometimes get with prednisone can last for a bit or a while, but that immunosuppressive risk is gone. So really, this is your current use as of today.